If you're past 60, this single overlooked habit might subtly elevate your stroke risk while you're asleep. No alert, no discomfort. One moment you're engrossed in a book or conversing with your grandchild. The next, your arm refuses to lift, your speech fails to emerge, or your equilibrium vanishes. As a neurologist, I've witnessed this instant all too often. Not merely in patients who smoke, maintain poor diets, or neglect workouts, but among elderly individuals who believed they were following every precaution. They avoided alcohol or excessive meds. They consumed vitamins. Yes, that's accurate. Daily, countless seniors pop over-the-counter supplements in hopes of preserving mental acuity, enhancing vitality, or bolstering their cardiovascular system. And although certain ones assist, others, particularly in elevated quantities or consumed at improper times, could silently heighten your chances of stroke, cerebral hemorrhages, or surges in blood pressure. Above all, during those fragile nighttime hours as you rest. In this video, I'll guide you through 9 everyday vitamins that might undermine your brain without your awareness, and I'll explain precisely what alternatives to pursue. Prior to starting, have you pondered whether your vitamins could be causing greater damage than benefit? If that's the case, you're far from isolated, and this content could potentially safeguard your life. Before we proceed, should you not have subscribed already, I suggest clicking that button and enabling the notification bell to ensure you catch every health insight crafted specifically for you. If this video resonates with you, drop a 1 in the comments. If it falls short, enter 0 to inform me how I can refine my material for you. 1. Vitamin D, the skeletal guardian that can subtly pave the way for a stroke during sleep. Vitamin D. You've likely heard that vitamin D is vital for robust bones, particularly with advancing years. Physicians, ads, even health features deem it indispensable for those in later life. And indeed, that's correct. At reasonable levels, vitamin D fulfills a key function in calcium uptake and skeletal fortitude. But suppose I revealed that this identical nutrient, when overconsumed, especially during the incorrect period of the day, might genuinely endanger your existence. As a neurologist, I've observed this alarming situation develop repeatedly. Allow me to recount a tale that lingers with me still. Walter, a 74-year-old former Navy veteran residing in North Carolina, visited me for a check-in following an abrupt stroke. He lacked any background of smoking, diabetes, or cardiac issues. Actually, he embodied self-control. He strolled each day, prepared his own dishes, and adhered to his supplements punctually. Each morning for more than a year, he'd swallowed a 10,000 IU vitamin D pill, convinced it benefited his skeleton and mobility. No physician had suggested it. He'd purchased it off the shelf after a companion brought it up, and the packaging promised strong bones. One morning, Walter's spouse discovered him collapsed on the sofa. His right arm was immobile. His speech came out garbled. His gaze brimmed with bewilderment. A stroke, and far from a trivial one. When we examined his blood tests, the findings painted a grim picture. His serum calcium soared to hazardous heights. His vessels had turned rigid, nearly brittle. His pressure had escalated through the night. The trigger? Vitamin D excess. Understand, vitamin D aids your system in absorbing calcium. Yet with excessive intake, notably exceeding 4,000 IU daily, the calcium fails to target solely your bones. It floods your circulation. And with surplus calcium circulating, your organism starts embedding it into your conduits, rendering them inflexible, constricted, and delicate. It's a gradual, stealthy progression, capable of accumulating over weeks or months absent any indicators. Then, one evening as you slumber, the factors converge. Rigid vessels, fluid loss, a pressure leap, a thrombus, and the stroke descends unannounced. What escapes most elders' notice is vitamin D's fat-soluble nature. Thus, it doesn't purge readily like vitamin C. It accumulates within you, particularly with routine dosing absent oversight. Typical counter bottles hold 5,000 IU, 10,000 IU, well surpassing the advised quantity for seniors, typically 600 to 800 IU daily, save for verified medical shortages via blood analysis. Consuming vitamin D at bedtime, which numerous folks do to avoid oversight, proves particularly hazardous. That's the period when your pressure varies naturally and your capacity to manage calcium dips to its minimum. If your conduits bear age-related wear, this resembles igniting a flame beside tinder. Walter pulled through, yet he limps now and drives no more. He shared words etched in my mind. I believed I was shielding myself. I was unaware I was laying a snare within my frame. Thus, my appeal stands. Refrain from elevated vitamin D doses unless your physician has assayed your blood and directed you otherwise. And invariably consume it come morning, not prior to retiring. Greater quantities aren't superior, particularly beyond 60. Yet if vitamin D can stealthily calcify your vessels and amplify your stroke likelihood, imagine if I disclosed that yet another cardiovascular-friendly vitamin might inflict something graver: hemorrhage within your cerebrum. Let's address vitamin E. You must absorb this. Should you remain engaged and deem these revelations useful, kindly post a 1 in the comments to signal your presence. Now, onward to item 2. 2. Vitamin E, the cardiovascular ally that might subtly provoke a cerebral hemorrhage. Vitamin E. Over decades, vitamin E has garnered acclaim as a cardioprotective free radical scavenger, a sort of innate barrier versus senescence. You've probably encountered it in periodicals or on supplement containers, vowing to aid blood flow, cognition, and dermal vitality. For numerous aged individuals, it appears a prudent, secure option. But reality proves far riskier and far more obscure. What if the very nutrient you've ingested to safeguard your ticker could instead incite intracranial bleeding? Permit me to draw you into the world of a past patient. Evelyn Brooks, 81, a former librarian from Ohio. She remained astute, humorous, and fond of crosswords. Each afternoon, she'd savor tea by the pane with a book in grasp. Her schedule flowed gently, honed through years. And that schedule incorporated a botanical vitamin E pill, 800 IU each day. She acted with caution. She merely sought to nurture her heart and sustain sharpness. What escaped her notice, though, was her unwitting entry into a therapeutic hazard zone. You see, Evelyn bore a valvular cardiac anomaly and received warfarin, an anticoagulant to avert thrombi. Her heart specialist oversaw her diligently, and her analyses stayed steady. But the instant she introduced high-strength vitamin E, sans informing her doctor, the balance shattered. One dusk, Evelyn endured a fierce cranial ache. Confusion set in, her speech garbled, then retching commenced. Her offspring hurried her to emergency. A cerebral image verified the direst, a hemorrhagic stroke from internal cranial bleeding. It stemmed not from a tumble, not from elevated pressure. It arose from her circulation, thinning excessively to coagulate, courtesy of merging warfarin with potent vitamin E. Here's the facet most overlook. Vitamin E at substantial levels functions as an innate blood fluidity promoter. It retards coagulation, akin to remedies like aspirin or Plavix. Now envision layering that organic anticoagulant atop a prescribed one. You might believe you're aiding your flow, but in truth, you're propelling your form beyond secure bounds, particularly in the minuscule, frail capillaries of your mind. The alarming aspect is its prevalence. Countless elders ignore the peril. The suggested daily vitamin E for aged folks is merely 15 milligrams, roughly 22 IU. However, prevailing counter supplements pack 200, 400, up to 1,000 IU each pill. Absent alerts, absent medical counsel. Evelyn chose 800 IU since the tag proclaimed natural and cardiac beneficial. She deemed it self-aid. She endured the stroke, but repercussions lingered. Her immediate recall never reclaimed its prior state. She ambles with assistance now and requires aid tallying finances, a skill she once imparted to grandkids. Amid sobs, she confided, "I merely aimed to tend my heart. I was oblivious to inciting my brain to hemorrhage. That's the core of my sorrow. Not solely the harm, but the motive fueling it." Like Evelyn, myriad elders ingest these aids from optimism, not folly. They aspire to remain robust, autonomous, keen. Yet sans true counsel, even the noblest selections can turn perilous. Thus, the fact you merit. Should you consume anticoagulants or even routine aspirin, consult your physician ere appending vitamin E, notably potent variants. You might sense naught presently, but within your cerebrum, a single frail conduit suffices. And recall, intracranial bleeding diverges from a standard clot-induced stroke. It tends graver, deadlier, less recoverable. No do-overs exist. Now, you could query if a mild nutrient like vitamin E can incite cerebral leaks. What of those vitality-enhancing vitamins spotted at the drugstore, the sort vowing keener concentration and sturdier nerves? Well, one specific item compels me to advise every elder to inspect their storage for, as excess can stealthily ravage your nerves and you might never reclaim normalcy. Let's discuss vitamin B6. The forthcoming revelation may stun you. 3. Vitamin B6, the neural aid that can subtly dismantle your neural network. Vitamin B6. We commonly link neural discomfort, foot prickling, digit numbness, shaky poise with maturation. And yes, our nerves grow frailer with time. But what if I informed you the precise aid hawked to shield your nerves might serve as the covert offender in their ruin? Vitamin B6 appears nearly ubiquitously. At apothecaries, warehouse outlets, virtual health vendors, it's frequently tagged as cerebral enhancer, neural bolstering, or vigor amplifier. It features in blended remedies for recall, circulation, neuralgia. But here's the undisclosed reality. Excess vitamin B6 transcends mere superfluity. It can prove neurotoxic. A patient of mine, Harold Jenkins, 76, a former hauler from Kansas. He devoted much of existence to roadways, transporting cross-state, sustaining on brew, instinct, resolve. Post-retirement, he sought self-care, superior nourishment, increased activity, honed attention. Akin suggested a product dubbed Neuralmax Nerve Defense. It vowed neural vitality, vigor, neural resilience. Thus, Harold procured it digitally, sans hesitation. Per tablet, 100 milligrams vitamin B6. He ingested 2 daily, routinely, exceeding a year. Harold sought me after recurrent odd tumbles. He described his limbs failing signals. He'd arise with numb digits and occasionally faltered holding his brew vessel. He attributed it to joint wear or years piling on, until a lavatory skid bashed his skull. His analyses cleared, pressure held firm, cardiac cleared. Yet scanning his aids unveiled the poignant issue. He absorbed 200 milligrams vitamin B6 per day, over tenfold the secure ceiling for elders, capping at 20 milligrams daily, encompassing sustenance sources. And the dread-inducing element? Vitamin B6 doesn't merely rinse away as assumed. It accrues in your frame, eroding the sheath encasing your nerves, termed peripheral neuropathy. It's akin to bearing a cable's insulation. The impulse weakens, turns capricious, ultimately halts. For Harold, harm had entrenched. We halted the aid promptly. Progression eased with duration, yet debility, stumbles, numbness persisted incompletely. He drives no longer. He employs a stick. And one tranquil afternoon, in hushed tones, he said, "Doc, I sought sustained acuity. I never conceived self-intoxication." And Harold isn't solitary. Innumerable elders stumble into this snare as tags appear innocuous or advantageous. They proclaim botanical, physician-crafted, neural secure. Yet the FDA oversees supplement quantities unlike scripted pharmaceuticals. And certain purported cerebral and vigor capsules pack 50, 100, up to 250 milligrams vitamin B6 per serving, frequently mingled with elements clashing erratically. Graver still, B6 excess harm emerges gradually. It commences with faint cues, perhaps minor prickles, an occasional trip. But upon evident symptoms, neural impairment advances, and in numerous instances, it endures. Thus, my counsel to every elder: shun presuming pharmacy availability equates safety for you. Scrutinize each tag, tally the milligrams, and should your aid claim neural aid, verify B6 content, for excess isn't superior. Excess can signify forfeited poise or locomotion, or the autonomy you've toiled lifelong to guard. Now, if the prospect of imperceptibly forfeiting mobility or feeling owing to a vitamin alarms you, it ought to. But more startling remains what occurs when you ingest a vitamin, amassing cranial tension and diluting your form into sensing a cerebral neoplasm. Yes, it's factual. And it initiates with a vitamin most elders consume for ocular welfare. Let's examine vitamin A and excess's cerebral toll. Should you persist viewing and value these disclosures, kindly comment a 1 below to affirm your engagement. Now, proceed to entry 4. 4. Vitamin A, the ocular vitality aid that can amass tension within your cranium. Vitamin A. If beyond 60, likely someone's urged vitamin A for your sight, perhaps to shield acuity, bolster immunity, or mature elegantly. Bottles abound. Ocular bolstering, sight safeguard, immune barrier. It seems straightforward. Merely a modest tablet to sustain your vision and form. But what if I stated excess vitamin A transcends ocular impact? It can stealthily elevate cranial pressure, aping a neoplasm, and occasionally inflict enduring cerebral and visual harm. This isn't conjecture. I've encountered it directly. Dorothy Simmons, 79, a former piano instructor from Oregon, a cordial, refined lady who rendered Beethoven from recall and tutored youth domestically. She stayed autonomous, cognitively keen, devoted to fine aging. Some years back, she commenced a dermal and ocular aid glimpsed on television. For elegant maturation, the ad vowed 10,000 IU vitamin A per pill. She dosed daily nearly 5 years. Indicators arose incrementally. Persistent cephalgia, hazy sight hindering score perusal, vertigo. Then one day, speech garbled mid-call with offspring. Kin dreaded utmost, a cerebrovascular event. Yet reviewing her images revealed no thrombus, no seepage. Instead, heightened intracranial tension, where liquor accrues cranially, stressing cerebrum, vertebrae, ocular conduits. The origin? Vitamin A surfeit. Here's what myriad elders miss. Vitamin A, fat-soluble, lingers unlike vitamin C or B. It hoards in liver, adipose, and over duration, your cerebrum. With age, hepatic clearance of vitamin A decelerates, notably if medications or aids burden liver capacity. In Dorothy's instance, routine 10,000 IU incrementally thrust her perilously. The formal elder ceiling nears 2,500 to 3,000 IU daily, encompassing dietary and multi-aid sources. Thus, surpassing proves alarmingly simple, particularly layering maturation aids, ocular supports, potent multis. The outcome? Pseudotumor cerebri, or spurious neoplasm. Indicators mimic cerebrovascular or true mass, intense cephalgia, diplopia, queasiness, poise or synergy woes. And absent early detection, tension impairs optic conduit enduringly, yielding irrecoverable sight forfeiture. Dorothy proved fortunate. We intervened timely. She endured lumbar punctures, easing tension, ceased the aid instantly, initiated therapy steadying poise and sight, yet never wholly reclaimed prior. Amid lacrimation, she confided, "I deemed self-beneficial for my form. I never foresaw cerebral harm." That remark endures as it's prevalent, afflicting thousands nationwide. Not be a negligence, but noble aims wed misguidance. Should you consume ocular or dermal aids, inspect the tag, note vitamin A quantum, and recall, this nutrient accrues systemically. Harm may evade sensation months or years until awakening to obscured sight, throbbing cephalgia, or graver. It's a dread notion that the nutrient destined to guard sight could, if mishandled, revoke it. And if that insufficiently startles, envision a nutrient scripted for lipid reduction, lauded cardiac salubrious. Yet at potent levels, it fails cardiac shield. It surges pressure, incites flushing, vertigo, even provokes a transient cerebrovascular pre-dawn. Permit me to recount niacin and the undisclosed senior verity. 5. Niacin vitamin B3. The niacin, vitamin B3, cardiovascular salubrious nutrient that can covertly surge your pressure and provoke a cerebrovascular. For myriad aged, lipid oversight spans lifetime. You've absorbed cautions: cardiac ailment, obstructed conduits, elevated LDL. Thus, when a nutrient emerges touted innate, medic-endorsed, vowing lipid decline and cardiac aid, it's simple to muse, why resist? Merely a nutrient. Harmless, aye?